2015 is an important milestone for Vietnam to assess the implementation of the Millennium Development Goals. Besides, 2015 was also the year to end the first phase of implementing the targets of National Strategy on Population and Reproductive Health and National Program for Vietnamese Population and Family Planning.
Hầu hết tất cả những cái mục tiêu được đặt ra trong giai đoạn 1, cả về dân số, kế hoạch gia đình cũng như chăm sóc sức khỏe, sinh sản, chúng ta đều đạt được. Chúng ta vẫn tiếp tục duy trì được mức sinh thay thế, khống chế được cái tỷ số gia tăng giới tính khi sinh trong cái phạm vi mà chúng ta đặt ra, cũng như là đã bước đầu nâng cao được chất lượng dân số và đáp ứng được đầy đủ các cái nhu cầu về phương tiện sinh thai và dịch vụ kế sinh cho người dân. Các cái chỉ số về chăm sóc sức khỏe bà mẹ và trẻ em cũng như là về chăm sóc sức khỏe sinh sản nói chung cũng đạt và vượt được các cái chỉ tiêu, và chúng ta đã hoàn thành được những cái mục tiêu về thiên niên kỷ, những cái chương trình kế hoạch gia đình, chăm sóc sức khỏe sinh sản, nâng cao sức khỏe của bà mẹ và trẻ em. Đó là 3 cái nội dung lớn mà chúng ta phải tiếp tục để làm đạt được cái kết quả cao hơn.
From the successes, the priorities for the period 2016 to 2020 are in place in order to improve the health quality of Vietnam's population towards fulfilling the common agreements in the United Nations Sustainable Development Goals.
Ladies and gentlemen, welcome to Sheng Vietnam on VTC10 Net Viet. In the framework of the National Strategies for Population and Family Planning in the period of 2016-2020, stressing the importance to reduce the differences in mortality and morbidity in different population groups and regions, and we're here today with the Deputy Representative of UNFPA, Ms. Risu Nakan, and she will share with us on the assessment of UNFPA on the work that Vietnam have done in the period of 2011-2015 and the directions for 2016-2020 in order for Vietnam to achieve this goal. Thank you, Ms. Risu, for joining us today. First of all, could you share with us the assessment on the work of Vietnam on completing the MDG 5?
So MDG 5 has 2 indicators globally. One is about maternal mortality, reducing the maternal mortality ratio by 3/4, 75%, between the 1990 and 2015. So the second one is the universal access to reproductive health. So on these 2 indicators, Vietnam has been doing really good and actually almost achieved the goal. In terms of maternal mortality ratio, it's a drastic reduction, and by end of 2015, we had achieved this goal. So it's a great news, and Vietnam is seen as a very much like a model for many countries. However, there are many disparities among the different population groups and different ethnic groups, and the maternal mortality ratio in mountainous areas are 3 times higher than the lowland areas. Also, ethnic minorities have more home deliveries, about 37%. It is said that 35% of young people have barriers in accessing the reproductive health services. So we need to narrow this gap, and it is a very important unfinished business for Vietnam.
What are the priorities for Vietnamese government in order to close the gaps between the different population groups and region?
This is definitely going to be a part of very important work for us, and I'm sure that the government of Vietnam also put more effort into these issues. So this means we really need a thorough analysis of the problem and listening to the needs of people. For example, young people often like to receive information through Facebook or other social media, and they like technology, the most advanced cutting-edge technologies. So we need to tap into that kind of interest and use that to reach out to young people. And also we need to be aware that young people are not a homogeneous group. There are people, young people with disabilities, ethnic minority youth, young people in industrial zones as migrants, LGBT young people. So we need to really address different needs of young people. The government of Vietnam may need to pay much more attention in the implementation of laws and policies. For example, there is a Ministry of Health circular about ethnic minority midwives, and they should be part of the official health sector workers network and should be receiving allowance. But this is not implemented in all provinces. Thirdly, that we believe that the government of Vietnam may need to really pay more attention on the issue of quality, because they have a very advanced system and structure to make sure that people have access to services. But some services are still low quality, and this is why we see the gaps. For example, the contraceptive prevalence rate is high, but also abortion rate is high. So this gap explains that there is some kind of a quality issue. Same for the sexuality education at schools. It exists, but maybe the quality has problem, and that's why we see the gaps in the knowledge in this area among young people.
Besides cancer treatments, population and reproductive health care services are also faced with many new emerging problems, many difficulties and challenges affecting the implementation of the objectives of Vietnam's national strategy on population and reproductive health.
Cái ngân sách càng ngày càng eo hẹp, đặc biệt là trong việc cung ứng các cái dịch vụ, phương tiện tránh thai, an ninh phương tiện tránh thai từ nguồn nhà nước là có nhiều thách thức và khó khăn. Và bên cạnh đó thì cái nguồn lực của xã hội cũng chưa được tiếp nhận đầy đủ. Và việc kiểm tra giám sát, việc đảm bảo cho người dân được nhận những cái dịch vụ một cách tốt nhất và chất lượng nhất thì chúng ta vẫn chưa có được cái cơ chế để kiểm tra giám sát cái.
The priority on reproductive health and sexual health family planning after 2015 will be the basis for the health sector to build and implement effective health plan for the next 5 years and population reproductive health strategy in the period 2016-2020. In which the Ministry of Health and other relevant units to actively provide information to adolescents and unmarried young people, improved public and private partnership in providing friendly service and contraception, building specific policies for reproductive health, sexual health of the youth, building national standards for quality assurance system of the contraceptives consistent with international standards.
Thì những cái giải pháp chủ yếu mà phải tập trung đó là vẫn tiếp tục phải duy trì và nâng cao cái chất lượng hiệu quả của cái việc công tác truyền thông thay đổi hành vi để nâng cao cái kiến thức, cái thông tin cho cái người dân để người ta tự nguyện chấp nhận và tự nguyện tiếp nhận những cái dịch vụ đó. Cái thứ hai là nâng cao cái năng lực, cái việc cung cấp các cái dịch vụ này ở tất cả các cái tuyến, đặc biệt là tuyến cơ sở. Trước hết là chúng ta phải tăng cái đầu tư để cái cơ sở y tế ở đấy có đủ điều kiện để cung cấp những dịch vụ này. Cái thứ hai nữa là phải có đầu tư thêm nữa để mà có những hình thức khác biệt so với những vùng miền xuôi. Đó là các cái đội dịch vụ lưu động được trang bị đầy đủ để đi đến cái vùng sâu vùng xa cung cấp các cái dịch vụ này gần với bà con hơn. Rồi cũng có những cái chế độ đãi ngộ đối với lại cán bộ y tế, những người sẽ cung cấp những dịch vụ này, cán bộ y tế và dân số, để người ta khuyến khích người ta và cũng tạo thêm những điều kiện hỗ trợ để cho những cán bộ này có cái điều kiện để đến với đồng bào.
In the context of Vietnam being a middle-income country, there's a need for innovative initiatives and approaches in building the healthcare system at rural areas and communities. What are your comments regarding this matter?
To address, for example, the need in the mountainous area, I think technology can play an important role. Even mountainous areas, actually, there are a lot of people with a mobile phone or even smartphone to have access to information. So we should be able to use that more. But for this, we really need a good partnership with the private sector, with the telecommunication companies. It really needs a multi-sectoral partnership and everyone working towards the same goal. And I think in this environment, it is really possible, for example, organizations like UNFPA to take a lead role in really creating the environment and the forum for all the partners to come together and discuss the solutions together.
What are some of the models worldwide that UNFPA would suggest for the Vietnamese government in order to achieve more creative initiatives in the healthcare system?
We invited a number of countries, mainly Asia Pacific, but also from other regions. One of the models we looked at before is Bulgaria, given the similarity of the political context. Vietnam can also learn from, for example, a country like Sri Lanka, which has been leading in the region to focus more on young people.
And finally, how would UNFPA support the Vietnamese government in achieving all the objectives of the national strategies as well as the SDGs?
Our focus is helping the Vietnamese government to achieve the remaining business of the MDGs, as well as really planning to how they plan to achieve the SDGs, the Sustainable Development Goals. So under this new framework, the main message, the slogan is leave no one behind. And it's really applicable for the case of Vietnam, where the overall socioeconomic development progress is excellent, but you see the pockets of problems and people who are left behind or may be left behind. So our aim is really to address the issue of inequity. As I mentioned, the ethnic minorities, the migrant workers, young people, unmarried young people, and so on, to have a real universal access to reproductive health. And that's a really important topic and our sort of goal in the coming years. So in this context, it's really important that we focus on the policy level change rather than going into the grassroots and delivering services or doing small projects. We don't see that those projects are unimportant, but it is important role for us to bring the lessons learned from those small projects into the policy level dialogue. So bringing in the international experience and expertise from abroad so that Vietnam can have the best possible policies as well as the mechanism to implement and monitor that.
Thank you so much, Ms. Prisunakan, for your sharing today.
Thank you.
And that's the end for our program today. Thank you so much for watching us. Hopefully, we have provided you with informative program on how Vietnam can achieve its national strategies for Vietnamese population and family planning, and that's stressing the importance of closing the gaps between different population groups and region. Any questions and recommendation, please email to sharingvietnam@netvittv.net. Thank you and see you again.